Well, Mikhail Gorbachev has one, and so do millions of others. The birthmark on Gorbachev's forehead is known as a port wine stain. Until now, there have been few options for removal. Dr. Eric Bernstein, a laser surgeon, is here to tell us about the newest advances in treating this condition. And Janice Becker is one of his patients. Good morning to both of you. It's Becker, right? Decker. Decker, I'm sorry. I'm looking down here. I'm sorry. Decker. Okay. Welcome to both of you. Now, Dr. Bernstein, I know that laser treatments have been available for port wine stains for a while now, but how have they advanced?
How have they evolved? The earlier treatments for port wine stains that were laser actually kind of burned the skin and left a scar. And they've slowly evolved since the mid-'80s to where we are now. And I'm lucky enough to have a couple brand new lasers, in fact, first one in the country, that the way they've changed is they basically remove the port wine stains in fewer treatments, and they remove them more completely. Even with the modern lasers that we've had over the last 20 years, removal is often incomplete. And the newer lasers are just incredible. They protect the surface of the skin, allow the light to get down deep, and can remove the birthmark without leaving any marks on the skin.
Well, Janice is living proof of that. When you came in here, I thought, okay, where's this port wine stain that we're supposed to be looking at? You had, tell us about where it was on your face.
It was, and it still is, on my eye. But it was all the way up my forehead.
Oh, we're actually looking at
We're
actually looking at a photo of you.
Extends back.
And how many treatments have you had now?
About 20 or so.
Yeah, I'd say about 15.
15 maybe.
She's had a number, and recently we started treating her with one of the newer lasers that literally I think just came out last year, kind of an advance on the previous laser, and it's really done a great job of removing the rest of it.
Tell us what the treatment feels like, Janice, when you're having it done.
It kind of feels like a snapping rubber band. Feels like a little bit of a burning sensation, but there's a cooling that prevents any pain, really. Mm-hmm. And it burns for maybe not while you're going through the treatment because of the cooling. It just kind of feels like that little snap. And then afterwards, there's a little bit of a burning sensation for maybe a half an hour or so afterwards. And then after that, you're fine.
Is there any kind of scabbing or anything that happens after a treatment?
None. I can put makeup on immediately after the treatment and go about my normal day.
Wow, you look incredible.
It's amazing. The improvement is dramatic.
How has it changed your life?
There are so many things now that I could do that I couldn't do before. I'm a scuba diver. I go camping and kayaking, whitewater rafting, and there are things that I couldn't do before the treatments.
And why couldn't you do things like that before?
Well, because I would always wear heavy makeup to cover it.
Right.
And you can't lug that stuff around all the time. And it wears off, so it just makes my life so much easier. I feel like I can do so much more now that I've had the treatment.
It's really freeing.
I'm really grateful.
Now, you said that this has been about 20 treatments for Janice. How long has that taken?
It takes a long time, and I've been treating her for years, probably. The newer lasers, how many years?
About 5.
About 5 years.
Mm-hmm.
The newer lasers remove them in many fewer treatments, so that's a huge advantage. And the other advantage is, even with 10 treatments in the old days, it would stop improving. And the newer lasers just make it. I have a new V-beam laser from Candela. It's a company up in Boston, and they own the rights to this cooling device. It was invented by a guy out in California, and it's a major advance. We don't, even with young kids, we really don't need to use often numbing cream or anything. I mean, it really doesn't hurt. The burning she referred to, we hate that word in lasers.
Right.
I'm just kidding. It's a hive reaction. People get kind of like a hive, like you would get, I don't know, after going out in the cold, for example. It feels warm for about 30 minutes to an hour, and then that dissipates, and it looks bruised. I mean, it does look bruised for about a week. And you didn't mention that. It gets bruised looking for a week.
Is it advantageous to have this when you're younger?
It really depends on the person. I mean, nowadays I would say, yeah. I mean, I think the right age to do it is the age at which, either if it's changing, if it's getting thick or getting large, bumps on it, then it's definitely time to treat it. In fact, you want to do it at the first sign of anything like that. The newborn baby, it's always good to show the birthmark to a pediatrician who's knowledgeable in these type of birthmarks, because they can be associated rarely with other problems. especially when they're on the face. Important to get eye examinations, even when you're a grown-up, into adulthood, because it can affect the eye on the side where it occurs. And I'd say as soon as, once the doctor's seen it, as soon as it starts affecting the patient and the way they feel, or the parents, it's time to start getting treated.
Janice, it's obvious it's an emotional thing for you. I mean, this is pretty dramatic. Are you done now with the treatments? Are you
almost?
Is that it?
Pretty much.
Almost?
It's just about gone.
Probably one more.
Probably one more?
Yeah.
Okay. Well, good luck with it. You look wonderful.
Thank you.
And thank you for coming in and telling us about this.
Thanks for having me.
It's going to change a lot of lives. Janice Decker and Dr. Bernstein, again, thank you. And if you would like more information about laser surgery and port wine stain removal, call 888-480-9099 or log on to cosmeticlasersurgeon.com.